Hello all, welcome to the another session that is a antibiotic stewardship program. Till now you have gone through a various session about the different antimicrobial agent. It includes their mechanism of action, adverse drug reaction, and the most important part is the therapeutic application of them. This session is dedicated about the antibiotic stewardship program. Objectives of the session is to recognize the problem of antimicrobial resistance, describe the roles of stewardship team, enumerate the goals of antibiotic stewardship program, and to understand the activities and the benefits of antibiotic stewardship program. Now you all must be aware about the what is the antibiotic or what is antimicrobial agent. So antibiotics, after its availability, they have transformed the practice of medicine. They're making once lethal infection which is curable now, and they can also making other medical advances, like they are helpful for a treatment of cancer chemotherapy, they are helpful for a treatment of organ transplant where there is a more chance to develop an infection. So the use of antibiotics to treat infection has been proven to reduce the morbidity as well as it also save the lives of patient. Now what is stewardship? It is defined as a careful and responsible management of something entrusted to one's care. When this definition is applied, it was originally applied in the healthcare setting as a tool for optimizing the use of antimicrobial agent. So it is known as an antimicrobial stewardship program. The question is arised why it is needed. What is the need of antibiotic stewardship? So there are three main reasons due to which it is needed to start antibiotic stewardship program. One is there is increased antimicrobial use in a modern practice. Second is there is a stagnant antibiotic development, and the third is increased resistance to available antimicrobial agent. We go one by one. First is increased antimicrobial use in modern practice. If we go through the report, as per the report, antibiotic use has been seen to be higher in India. If we can see the report, it says that total 39% of rise in a rate of antibiotic consumption in India. And if we can compare it data that almost 48% change in a total use between 2010 and 2020. So there is a total 48% increase in a consumption rate in an antimicrobial agent. And if we go all over the world, globally there is a rise in the use of antimicrobial agent. And as per the data available from the CDC, the report of CDC says that almost 70% of antibiotics which were prescribed, they are necessary to use for that particular infection. But it also says that unfortunately, it also says that at least 30% of antibiotic prescription are unnecessary. So out of whatever amount of antimicrobial agents which were prescribed, about 30% antibiotic which were prescribed, they are either they are not necessary or their use is inappropriate. So it is necessary to watch that where this 30% of antimicrobial agents, how we can reduce that inappropriate use of antimicrobial agent. Second is there is a stagnant development of antibiotic. If we go through the data, or if we can go through the timeline which was available in between 1930 to 1960, almost many antimicrobial agents were synthesized and they are available in the market for a treatment purpose. After that, after 1960, the synthesis or availability of new antimicrobial agents are very limited. Very few antimicrobial agents were available, and gradually the synthesis of antimicrobial agent were reduced. So we can say that the period 1930 to 1960, this is a golden era where the majority of antimicrobial agents were synthesized. But then after, the synthesis were reduced. And the third one is, this is the most important, that is there is increased resistance to available antimicrobial agent. Again, if we can go through the timeline, here you can see that these are the synthesis year and at which year antimicrobial agents were develop a resistance. So if we can see that penicillin, which is discovered before 1930, but around 1945, organism become resistant to penicillin. Same thing where happened to a tetracycline, just synthesized in around 1940, and within a 10 years, again organism become resistant to this tetracycline. Also being a broad spectrum antimicrobial agent, the use of tetracycline is reduced because of development of resistance. So the same thing where happened with vancomycin, methicillin, carbapenem, gentamicin, cefixime. So there are many more antimicrobial agents. After the discovery of their, within a short period of time, microorganism become resistance towards the use of them. So there are three main reason to start antibiotic stewardship program. One is due to inappropriate use of antimicrobial agent. Second is stagnant development of newer antimicrobial agent, and the third is increased resistance to development of antimicrobials. What is a resistant antimicrobial resistant? Antimicrobial resistance means the ability of microorganism to adapt as well as they can grow in the presence of antimicrobials. So there is no any adverse effect produced on an organism because of availability of antimicrobial agent. So organisms are safely survive in presence of antimicrobial agent, and that condition is known as an antimicrobial resistant. And the most important thing is that uh, uh, certain diseases which are caused by multi-drug resistance microbes, if the situation is that the disease is because of multi-drug resistance, they are not at all treatable, and day by day the condition is worsen. So it is the main concern for emergency of resistance is, again it is due to inappropriate use and misuse of antimicrobial agent. So it is necessary to watch on the use of antimicrobial agent. So to address the antimicrobial resistant, the World Health Organization uh, had issued a global plan of antimicrobial resistance in 2015. The plan recommended that each country developed and implement a national action plan about a antimicrobial stewardship program. So on the basis of that, India released its national action plan for antimicrobial resistance in April 2017. Uh, this plan is about for a 5 years plan. That the highlight of this plan is uh, the it can outline the priority area to implementation strategies to reduce how to reduce antimicrobial resistance in India. So main goal is to watch on the use of antimicrobial agent and how to reduce development of antimicrobial resistance. Antimicrobial stewardship. After confirming that the patient has an indication for an antimicrobial therapy, means once it is identified that the patient need a specific antimicrobial therapy, antimicrobial stewardship team is there. The team which can guide the right selection of drug, can also guide to select right dose at a right duration at a right time, and it is given by the right route of administration. So the main purpose of antimicrobial stewardship is to select right drug, right dose, right duration at a right time and by given by the right route of administration. It result in the best clinical outcome for a treatment, or it can be given for a prevention of infection. When it is administered, person may develop a good clinical outcome with less toxicity, and there is a less development of resistance. So ultimate goal which is produced with the antimicrobial stewardship is to achieve a best clinical outcome with less resistance. So on the basis of that, goals of antibiotic stewardship program is to work with a healthcare provider so that their patient receive the most appropriate antimicrobial agent at the correct dose for the correct duration. Second is to prevent overuse and misuse as well as abuse of antimicrobial agent. Overuse here it means sometime a physician often prescribe antibiotics when they are not required. Misuse means there is a continuously uh, treating a patient with ineffective antibiotics without any culture sensitivity report, that is known as an misuse. And when we can see what is abuse, abuse means uh, pref- uh, preferring a particular antibiotic over the other equally effective antibiotic, that is known as an abuse. So the main goal of ASP is to prevent overuse, misuse and abuse of antimicrobial agent. And third, which is most important, to minimize development of antimicrobial resistance. Now, who are included for this program? Who are included in an antibiotic stewardship team? So, the stewardship team, it is, we can say that it is a multidisciplinary team which include an infectious disease physician, a pharmacist, one who can supply the prescribed antibiotic and keep their usage record in the hospital. Along with that, there is a clinical microbiologist, as well as there are other physicians and other healthcare providers. Their role is important because they have to they must ensure the acceptance of suggestions which were given by the ASP team, or effective implementation of ASP program in a hospital. And along with that, there is a administration person can also be included to implement the program. There are various few elements, essential elements of antimicrobial stewardship. One is prospective audit with the intervention and the feedback. Second is formulary restriction or pre-authorization. Third is switch over from parental to oral therapy. Fourth is streamlining or de-escalation of therapy. Fifth one is appropriate use of microbiology laboratory. And the last one is education for a healthcare provider. So we discuss one by one what is the main function of individual element. First is prospective audit with feedback intervention. The main activity of the ASP team is to identify the current resistant pattern, which is based on the data of uh, microbiology laboratory, and on the basis of that they can give a feedback to a clinician regarding the resistant pattern. So on the basis of that, there is a improve antibiotic use by optimizing selection or specific drug selection, their dose, their duration, and the route of administration. So the main function is to outline the resistant pattern, and on the basis of that feedbacks were given to a clinician or a healthcare provider that this organism are resistant to this many antimicrobial agent, so better to go for this and this antimicrobial agent. Second is formulary restriction and pre-authorization. The antibiotic stewardship team can identify an antimicrobial agent which require a prior authorization before prescribing and ordering it. That means why it is necessary, why pre-authorization is necessary. The main aim of this is it serves to limit the use of selected antimicrobial agent for a specific indication which is based on a local resistant pattern and the hospital formulary. So it basically guide that some antimicrobial agents which are reserved for some specific indication. So the resistant pattern that is based on a resistant pattern of particular hospital. As well as it also provide a review of the antibiotic order by the ASP team. That means uh, once they can review the antibiotic order, they can advise the healthcare provider to either continue or discontinue antimicrobial agent, or to change or adjust the antimicrobial agent as per the culture sensitivity report, as well as on the basis of clinical feature of the patient. So the main aim of this element is just to pre-authorize the use of antimicrobial agent, whether the prescribed antimicrobial agent is indicated for or not indicated, or whether to continue it or discontinue it, whether to change it or to adjust the doses of it, means on the basis of culture and sensitivity report. Third is switch from parenteral to oral therapy. Most of the time, antimicrobial therapy, uh, when the patient is admitted with a serious infection in a hospital, they need a parenteral therapy. So once the parenteral therapy is initiated, at that time, at initial level, it is okay to start with the parenteral therapy, but there are certain antimicrobial agents like fluoroquinolones, clindamycin, metronidazole. Their bioavailability can be enhanced if we can switch over to an oral route of administration. So once a patient meets a defined clinical outcome or clinical criteria, it is better to allow a conversion to oral therapy. So patient now switch over from parental therapy to an oral therapy. That conversion is helpful to optimize its bioavailability, to optimize its pharmacokinetic parameters, as well as it can also reduce the length of hospital stay. Fourth one is streamlining or de-escalation of antimicrobials. Sometimes excessively use of broad spectrum therapy leads to selection of antimicrobial resistant development of antimicrobial resistance. So this can be resolved when a culture and culture sensitivity report become available. After that, uh, clinician were given a feedback regarding the availability of culture sensitivity report, and then to switch over to a, or not switch over but streamlining or de-escalating a empirical therapy to a more targeted therapy, that which organism is sensitive towards which particular antimicrobial agent, so that that can decrease the antimicrobial exposure towards a broad spectrum antibiotic, and the patient may get a more targeted therapy. So streamlining and de-escalation means after availability of culture sensitivity report, select a specific antimicrobial agent which is best suited to that particular organism, and that may lead a more targeted therapy. And fifth one is appropriate use of microbiology lab. The clinical microbiology laboratory, which plays a important role in the timely identification of microbial organism and the performance of culture sensitivity report. So, clinical microbiology laboratory should be actively involved in resistance surveillance, and on the basis of that, local antibiogram with pathogen specific susceptibility data should be updated at every time. So on the basis of that, to optimize a expert recommendation for a empirical therapy, and on the basis of that updated information, ASP team can make a small booklet for a clinician regarding the recommendation for a empirical therapy, as well as uh, the resistant pattern of organism. Last element is education. Education is considered as an essential element to influence the prescriber behavior. So we can provide, ASP team can provide education by lecture or by providing them information on a pamphlet. So that should be what we can say, that it should be an complement activity of ASP team, that all the healthcare provider may be involved in some training program regarding the use of antimicrobial agent, regarding the prescribing behavior. So ASP team can give should provide a regular update on antibiotic prescribing behavior, antibiotic resistant pattern, and also infectious disease management that can address both at national level and at a local issue, that what is a specific resistant pattern in your hospital, and on the basis of that which organism are susceptible to which antimicrobial agent. So education is also necessary just to refresh the knowledge of prescriber. So these are the six elements which which is followed by the antibiotic stewardship team. To summarize this, antimicrobial resistance is a serious global threat required to reduce inappropriate use of antimicrobials, which is prevalent in the outpatient setting. So, the first and most important goal is to reduce the inappropriate use of antimicrobial agent. The main aim is of ASP is to improve antimicrobial stewardship program, or to start a antimicrobial stewardship program with the four strategies to implement it in a effective way. First is auditing for a intervention, that which type of or antimicrobial agents which are going to be prescribed, it must be audited by a ASP team. Then there is a pre-authorization for antimicrobial use. So that pre-authorization of certain antimicrobial agent can reduce the inappropriate use of antimicrobial agent in some particular indication. Third is de-escalation and change over the route. De-escalation means after availability of culture sensitivity report, it is better to change over a therapy for empirical therapy to a targeted therapy based on a culture sensitivity report. And there is a change over a route of administration. For a serious condition, it is necessary to start a therapy with the parental administration. But once the patient condition is stable, then after switch over to an oral therapy, because certain antimicrobial agent, their oral bioavailability is higher in comparison with the parenteral route of administration. And the last one is education for a healthcare provider. It is most an important part that all healthcare provider must be educated regarding the inappropriate use of antimicrobial agent. They must be given a guidance to prescribe, to change their prescribing behavior on the basis of availability culture sensitivity report. And they also must be guided regarding the use of specific certain antimicrobial agent. Their use should be restricted to reduce the development of resistance. So this is in short about antibiotic stewardship program. I just given a brief outline. Thank you.